Hey, my name is Mandy Irby and I'm the birth nurse. Welcome back to my channel where I help busy people and birth professionals give birth boldly. And I have a super special guest today and we are talking about birth trauma. Is it preventable? What does it look like? What happens if a nurse has untreated trauma? How does it affect them and their future patients? Holy cow, what can we do about it? You do not want to miss. The end is a lightning round and she is super funny. I am here with Krysta Dancy, and Krysta is a clinical supervisor and co-director of the Place Within Counseling Center, a nonprofit in Roseville, California. She's also a therapist, a counselor in private practice, specializing in birth trauma, trauma therapy, and individual therapy. And I know Krysta online through her as a birth trauma expert through her work with parents and birth professionals. Did I skip anything that's big in your life right now?
Yeah, so last year I opened sort of an online space called the Birth and Trauma Support Center.
Yeah.
So
that's only online. Mm-hmm. It's a website.
It is, yeah. And at this point, the concept is I want it to become a place to send people who need referrals. Okay. That's what I'm really focused on at this moment, as well as like education in the field of trauma-informed maternity care. Mm-hmm. So the idea is, as people started to get to know what I did, they started to contact me, and at some point, like I just couldn't help everybody. So I was like, well, let's get together. There have to be other people in your local area that you're just not connecting with who are able to help. So that's what that is about.
Super important. I wanted to snag you. We're at the same conference together today, and I wanted to snag you because this video series is on birth trauma, and there's a little bit of that here this week, actually a lot more than I expected here this week, which is really, really great. So you got into the role of birth trauma kind of maybe accidentally? Yeah. It sounds like people came to you and said, there's this problem and we really want you to be the one that fixes it. And you said, okay.
Yeah, I always say it's the specialty that chose me.
Okay.
Yeah, so I started out about 15 years ago and I happened to have a lot of veteran clients who had a great deal of PTSD. Yeah. And so I was already sort of headed towards this trauma specialty already and kind of doing trainings and expanding my learning in that area. And then because I was becoming a parent at the same time, I also happened to attract all these new parents. Mm-hmm. And I started to realize like some of the parents looked a lot like my PTSD clients, and I couldn't quite make sense of that. Mm-hmm. Yeah, so that's how it was born.
Did you hear that?
Pardon the pun.
Birth people look like
yeah.
war veterans who are experiencing PTSD.
Yeah, and I don't want to say like they experienced the same thing, but in terms of how it was presenting in their life, the way it was impacting their life, it looked similar. Yeah.
So that's huge.
Right.
That's something
I was like, we've got to do something about this.
Yeah, you couldn't ignore that.
At the time, I didn't know what I was looking at because it wasn't really being talked about professionally, but now we know because there's been all this good research that over 30% of parents have some form of trauma after birth.
Oh. And you say parents?
Yes.
Including partners and other family members?
So no, there's not research on partners. I just use the inclusive term parents to mean anybody who's giving birth. But as far as I know, there's no large scale research on partners. I'll say from my clinical experience, yes.
Okay.
Yeah, partners. And one of the things I talk about is sometimes partners have trauma when the person giving birth doesn't. Mm-hmm. Because sometimes they're aware of things in the room that are happening, or they're more aware of the danger, or they're more aware of the abuse, or whatever it is, more so than the person giving birth.
Or misunderstanding what's going on.
Being confused and overwhelmed, especially feeling powerless. Like, I'm not involved in this at all, and I'm just watching helplessly. So, partners are impacted, but there isn't any large-scale research on that.
So I don't think I talked about that on this channel much, but I'm really glad you brought that up because it impacts the family dynamics once you go home. It impacts the birthing person's recovery once you go home. Mm-hmm. Huge. We won't dive into everything. I just want you guys to get a blip of what you do so they can go find you later. You have online groups for parents who've experienced birth trauma, professionals working with birth or traumatic birth. What surprised you the most about these groups? So
what surprised me most about the groups actually is how much people are able to get out of that format.
A Facebook group online.
Yes, because I started it because I would do interviews like this. People would say, where can people go? And I would have no place to send them.
Yeah.
Most of the resources that I knew were in the UK, which are really good resources, but they have a very different system.
Okay.
And so a lot of the resources weren't fitting our model of care.
Yeah.
Like, for instance, in the UK, a lot of the trauma would be related to like lack of intervention, right? So it's a really different system. They have a socialized medicine system. So I was like, I don't have any place to send you that's going to talk to your experience. So I was like, well, I'll just make a space, thinking nothing of it. And
it's kind of a big deal.
Turns out that like people get, that's I think the most surprising thing is that people can actually connect and share and get a lot out of it, and that's the feedback I consistently get. Which to me is like amazing, because you can reach people who are in areas that are isolated or don't have access to mental health services, and
so
that's really neat.
A group of people that know something's wrong, they don't know necessarily how to get help, what the help looks like, if it's in the community. But you're planting the seed so that it is growing. So as more people become aware of it, they watch all of my YouTube channels, they go to your Instagram, they find us and they become aware of it. You'll have this enormous network already built up, which is amazing. It's growing very quickly.
With the professionals group, that was again like a second thing. It was like, well, we want to have professional conversation. It doesn't really fit in this room that we're trying to center the birthing person. So let's take the professional conversation elsewhere.
Yeah.
I think what surprised me most about that was just how hungry everybody is for the conversation and how there's almost no place to have it. I expected to start the group thinking it will educate me. Like, I'll ask for resources and all of these really amazing people will have resources to share.
Yeah.
And what I keep getting is more of like, we want to talk about not just the trauma that happens for people giving birth, but then the trauma we experience as birth professionals, right? The trauma we experience as nurses or midwives or obstetricians or doulas, our own trauma. How do we deal with that? So that was this expanding like, oh, that conversation isn't happening.
It's not. It's not happening in nursing school. It's not happening with OBs and nurses together. I don't think it's happening in medical school.
No,
it's not happening inside hospitals.
I'm floored when I'll ask, okay, so what happens in your facility if you as a medical provider have like the death of a baby? And what I hear over and over again is, I don't even get a bathroom break, right? Like, I go right into the next room and have to put a smile on my face. The amount of trauma that our providers have is unreal.
It's unreal. And then we're caring for such a vulnerable population. We really want to get our shit together. We want to feel confident and comfortable in our role. Okay, so huge again, when I talk to labor and delivery nurses and I just put a little seed in there about you have your own secondary trauma maybe, and it's okay to like open that door, but I always say, find some professional help to help you, to help support you in that. And so that's where we can go now if we're like, I'm a little curious, but I don't know. We can go online, which is super great because you don't have to meet 3 therapists and then be like, I don't know how to help you, because that's the worst feeling.
Yeah. And they don't.
Yeah.
A lot of therapists don't know how. And so, mental health care is already pretty inaccessible.
Yeah.
Right?
Yeah.
Just like geographically, a lot of people are in places where there aren't even options.
Right.
Affordability, whether they're in network or they're taking new clients, and then there's this whole idea of specialty.
Like I talked to you, like where do I find EMDR? Can I do it online? Anything online is so much more accessible. And just starting the conversation if other people are feeling this way. Yes, it brings up your crap, but hopefully in a way that you can work through it so that you can be a better nurse or be a better birth worker.
How are you? I just think everybody in that room is human. In that birth room is human, right? And if I am there attending you, but I have all of this trauma that I am trying to keep at bay, that really eventually leads to me becoming numb or disconnected because I can't go there, right?
What would that look like or feel like?
As the patient or as the provider?
Nurse.
As the nurse. Okay, so generally I think like the early stages, I'm just thinking out loud here for a minute. I think like the early stages look like a lot of mood fluctuation at first. At first it's a lot of like...
I'm way past that.
Right? At first it's a lot of mood fluctuation. At some point that is overwhelming. And if you don't have other resources, you get to a point where you have some form of disconnect. You have to. Because you can't walk into a patient room and burst into tears. You have to keep functioning. It's not an option for you to shut down. And so the disconnect looks different. For some people, the disconnect is like a numbing emotionally. For other people, the disconnect is through some form of like self-medication, substances, right? It looks different for everybody, but that disconnect is the commonality, right? Because if I open this door a crack, it's going to flood me. So I just keep everything over there.
I clocked in, I have to do my work.
Right. And so then what ends up happening is if that disconnect is so important to your own stability, then when you're in the room with somebody who has their own trauma experience, they have to be on the other side of that door too.
Oh.
Right? Because if you let that in and you relate to that in a connected way, then that's going to start a rabbit trail down to your own stuff.
Right.
Right.
And so every pregnant person is like, oh no.
Whoops.
This isn't like they can't keep working.
No.
Or they can't provide empathetic care.
Right.
So when we talk about secondary trauma with nurses, I did mention that it doesn't mean every nurse has trauma or is walling things off and or can't give amazing care.
Right.
But sometimes nurses don't know what to do, how to get help. Right. What do you say to nurses who are like, oh my gosh, is that me?
Right. Yeah, so a couple of things. I think that it's important to say that most nurses give excellent care.
Thanks.
I think the people who are suffering is mostly the nurse.
Oh,
right? Like that's where the suffering often is.
Yeah.
Because that comes at a cost, like keeping all of that intense emotion at bay, right?
Yeah.
So I think it's them that's mostly paying that price tag. Most of the nurses I know give excellent care and get into nursing because they love giving good care, right? Like that's what they're in it for. One of the things that I think is important to say is that the literature actually shows us that there are things that are protective for nurses, and one of them has to do with work environment. So nurses who rate their work environment as supportive, who have good collaboration with their fellow nurses, they do better. They have lower rates of trauma. And if they have trauma, they heal faster. So there is something so important about that peer support, right? Because trauma is isolating. If you're in a work environment where you are shamed for talking about that, you're going to have a lot harder of a time than if you're in a work environment where someone will like offer you empathy and comfort.
But I already can think of like a million times when that happened.
Right.
When your work family just sees your face and you're like, don't come near me. And they're just like, they're hugging you. And you're like, okay, thanks.
Like,
and then you go,
that.
and they know you well.
Yeah.
And they can be that, we do sounding board stuff, but also that like heavy, solid emotional support.
Yeah. So I think that there's a good, I believe deeply that there's real potential for like institutional solutions to this, because if we know that work environment impacts it.
Yeah. So if we can teach from the top down, we can help them stay super happy in their job, stay really supported and get out of the trauma part of it.
Right. And having an environment that actually encourages you to take care of yourself.
Yeah. And
which is not always, and allows it. Right. It doesn't penalize it.
Yeah. It doesn't just say go do self-care.
Like, good luck.
Right. Oh, I cannot wait for
good luck with your self-care.
Good luck with your self-care. Go take a bath when you get home and don't drink too much.
Right.
Not that helpful. I already know that.
Yeah.
I cannot wait to revisit this in a year when things have changed and you are teaching at bigger facilities, and there is, hopefully there'll be studies, maybe 5 years, but I really like that you're positive about it.
Thank you.
And like confident that there'll be change.
Yeah, and I feel like the whole field of trauma research to me leads me to be really optimistic.
Good.
Because what it tells us is that there's a lot more trauma than we ever thought as a profession, just across the board in the general population. What also tells us, again, is that it's like, broken record, it's highly treatable. And it when people's trauma heals, their ability for connection deepens, right? And so I think that there's this like sort of beautiful human race aspect of when we all own our stuff and we engage with it and don't just wall it off in whatever way that looks, like we engage with it and we heal it and we work through it, like our ability as humans changes.
So parents, we can
parents and as partners with each other and as friends, and then as the care we give, right? Like all of a sudden our ability for empathy deepens, our ability for connection deepens.
Oh, how nice to have a nurse to just be like, you're totally going to get through this.
Yeah.
I did it. We did it.
Yeah.
These other parents did it. You're totally going to get through this. As a new parent, how powerful.
Right.
To hear that.
And also to have a nurse be like, yeah, I get it.
Yeah.
Like no shame.
There's not a lot of studies I learned from you yesterday about prevention and like pre-existing.
Yep. There's no studies about prevention.
Okay, not a lot. There's none about prevention. So it's almost seems hopeless. It's not hopeless though. So who's more at risk? Like if you're talking about, if you're pregnant and you're listening and you're like, crap, Mandy, like I just hopped onto this video. I'm so like confused now. They know, they've heard about bad births or people who had bad birth experiences because they share that often.
They like to tell the pregnant person's stories.
Right. Yeah. And that's
rabbit hole.
That's a whole other thing.
Yes. Yeah. We could talk for days. But who's more at risk, maybe? Who, as a birthing person, is more at risk or thinking about, like, what's the prevention there? Not working with your nurse. That's totally different and aside. Yeah. But what's the prevention for, oh, my gosh, am I going to walk into something that I'm not ready for from myself? Or how do I prevent birth trauma in labor?
Yeah, really good questions. Okay, so people who would want to maybe keep an ear out because they're more at risk would be people who have a previously traumatic birth.
Okay.
They're at higher risk to have one again.
Okay.
People who have a sexual assault history are slightly higher vulnerability to trauma. People who have depression during pregnancy, interestingly. People who have a high intense fear of birth.
Yep.
Are more likely. So those are some signals, like if you fall into those categories, to maybe just know what resources are in your area so that you can help yourself if it comes to that. But I mean, the upshot that I always want people to hear is that trauma is highly treatable. Highly treatable. Highly treatable.
That's amazing.
Yeah.
I love when you say that.
It is. And that's why I want to spread the word, because oftentimes people get trauma confused for like anxiety or depression. And so they're treating it, if you don't have appropriate assessment, you don't have appropriate treatment. So they're treating the wrong thing.
Okay.
And so then it's resistant, it's not getting better, they feel really despaired, or they feel really hopeless and they feel despair. And what I say is, you know what? Correct assessment leads to correct treatment. Trauma is highly treatable, especially birth trauma. It really is.
That's so amazing.
Yeah.
So if you feel like, oh my gosh, no, I think this is connected to my birth, you're just not talking to the right person yet.
Yeah.
Okay. So you can go online and go backwards, not necessarily face-to-face, meet every counselor, go online and see if there's resources there to find someone who speaks that birth trauma language.
Right.
If you're already on the other side of your birth.
Right.
Okay.
Yeah.
And then preventing it is just gathering resources. And if you're feeling pregnancy depression, work on that. If you're feeling the fear, work on that.
Yeah, so this is where I'm going to just use my own experience because we don't have evidence about this.
Okay.
I think that doulas are preventative. I think that doulas are protective. Yeah. I think having that continuous emotional support from prenatal through to postpartum with somebody you feel comfortable with, that you can debrief whatever happened, that can help clarify and communicate things that are unclear to you, super helpful. So I feel really good about recommending that.
That's awesome.
Yeah.
That's also not accessible always. We've had lots of conversation at this conference about the accessibility of doulas,
right.
Doulas getting fair pay, being able to work with all types of communities. And I'm from a smaller community, so there's definitely, I see huge pockets of need for that.
Yeah.
But you can also get creative sometimes.
You can get creative, and if it's not in, it's not in reach for you to have a professional doula, I think that a secondary choice would be to have somebody that you trust continually there.
Emotional support.
That you talk about ahead of time if you have pre-existing trauma, like what your triggers are, and you talk about what your fears are, and then that person is in the room. Yeah. Because people can't, unless you've given birth before, it's really hard to anticipate how much your problem-solving centers of your brain just don't work when you're in labor land. So to have that outsourced to a person you're confident in and a person you feel comfortable with, so then they can be like, I know this is going to be triggering. Let me buffer that. Let me help redirect that. Let me support you and let you know you're not alone.
Yeah. Or that seems technical. And I'm thinking of like a sister or, a friend where they're just like, I don't even know, but I'm not leaving you.
Right.
That's it. Done.
Yep.
Cool.
Absolutely.
Yeah. Thank you for this. This seems reachable.
Yeah.
And I get overwhelmed, and I talk to you guys about how big I think this problem is because so many people don't know about it. But it is fixable. It is reachable.
It is. It really is.
Yeah.
That's the upshot is it's treatable. I believe it's preventable. We need to show that in evidence. It has such a far-reaching impact. And so the awareness of it is so important because if you can recognize it, treat it, heal from it, move on.
Right.
Yeah.
You're a parent.
You're a parent.
You're the best parent. You're yourself. You can feel confident in other situations because you've gone through this big event. Right. And I don't know, there's something about when you talk about it, there's just like, maybe because you're a therapist and I just gravitate towards that, but like no stigma. Yeah. Like this happens a lot. Right. We can talk about being like, I hate my birth right now, or this is hard. And you just make it feel like it's okay. It's actually treatable. It's reachable. It's not weird. It's not because you had a bad doctor, not because it's just so many facets to it.
Yeah, and I think part of that, I'm glad that that's how it feels when I talk about it, because that's how I feel about it. I think part of that is just having an understanding of like the formation of, I won't go there because it's super nerdy, but like the formation of trauma in the brain. What I want to say to like parents who are experiencing this is like, trauma is not a failure of optimism. Like, it's not a failure of will. It's not a failure of gratitude. It's not any of those things. Like, you can be grateful and have trauma. You can be optimistic and have trauma. You can be a positive person and have trauma. It is a specific neurological central nervous system response. Like,
sounds easy.
like, no, that's not anything to be ashamed of any more than, I don't know, any other biological response, like hiccups.
Right. I started my period today. Oh, I'm sorry. It doesn't mean I'm not happy. I don't love my kids. No,
Right.
no, I just started my period. Right. I can't help it.
It's like, this is what my brain is doing. And so I want people to think of getting help as like, I'm just going to give my brain what it needs. Like, I take a vitamin to give my body what it needs. I'm going to do this to give my brain what it needs, because my brain wants to heal, but it's just having a hard time.
So the way Krysta teaches, and I got to meet her in person, and the reason why I love going to conferences is that I get to give standing ovations to the people that I love to learn from online, which is so amazing. And like me, not selfish. I get to like thank them. But the way Krysta teaches is just like this, like, learn what how your brain is trying to heal itself, and that feels good. Like, your brain's smart.
Like, I've got a teammate. I don't have to work against it.
Right.
It wants to help me.
This is how it's healing me, and I'm going to give it a little food.
I always think of it like I always think of it as this like out of control puppy. Like, it's so like this golden retriever puppy is like so well intentioned, and it's like ripping up your slipper, but it's like bringing it to you all like, I bought you your slipper. It's trying. It wants you to feel good. It wants you to heal, but it's just having trouble. And that's what trauma is. It's just not getting there. So we just need a little.
That's awesome.
Right.
That's so good.
No big deal.
So
Let's just fix it.
No big deal. So tell us how we can find you best.
I do have provider classes. You can find my provider classes for birth professionals at thepsychologyofbirth.com.
Okay.
And then you can also find me on Facebook. I'm on Instagram. I'm trying to get good at posting. Instagram endlessly confuses me.
We'll tag all that down below.
Yeah.
And I'll tag your groups down below. So
Awesome.
if someone wants to get into a birth trauma group, a parent or a professional, you can go in, sneak around.
And the referral list.
Yeah.
And that's another good one. Yep.
Okay, so the referral list is
Yeah.
also down below. So if you want to get on that list for your local community, click the link below.
Or find people near you who specialize in this. Like doulas, midwives, therapists who know about this.
Huge.
Yeah.
Lightning round.
Okay.
I'm sorry I didn't tell you about this.
No, I think you did, but I thought you were joking.
No, we're trying out a new thing.
Cool. I like it.
Tea or coffee?
Coffee. All the way.
Cats or dogs?
Dogs. Although I like cats, but I'm allergic. So we can't have the relationship that I want to have because they can't touch me.
Or be in your room.
They love me though.
Oh.
Because I think they sense that I don't want them to touch me.
That's how cats are.
And they're like, ooh.
Yeah, you ignore them and they love you.
Yeah, so it has to be dogs because they can be my friends.
Okay.
Yeah.
What did you eat for breakfast?
Nothing.
I knew you were going to say that.
You did.
Just from yesterday.
Oh, yeah. Yeah, nothing. Yeah.
Do you have any tattoos?
No. But I am about to hit a milestone birthday, and I'm thinking about it.
Do you want to talk about your milestone birthday?
40.
Oh,
yeah.
okay.
So I feel like getting ink for the first time on like a milestone of like 40 would be kind of fun.
Why not?
Yeah, like everyone else, not everyone. A lot of people do it when they're young. Some people do it when they're older.
Yeah.
It's like, that could be fun.
That could be fun.
I feel like I have a better shot now than when I was 18 of picking something I will still want.
Right. Your brain is developed all the way.
And like it'll probably involve my kids, which I don't feel like I'll ever regret.
Yeah.
Yeah.
And at 18, you
I haven't decided if my husband makes the cut. Well, I'm just kidding.
Okay, birth superpower. If you had a birth superpower, what would it be?
I don't like as a birthing person, as a person attending birth.
What would be your birth superpower? So you work with birth people.
Yes.
How would you change birth culture with your birth superpower?
Oh my gosh. I make it trauma informed. Can that be? I feel like that's so big.
Like wherever you walk, your bubble is trauma informed?
Yeah, wherever I go, it would be like people would give consideration to the trauma
Just
piece.
be like awakened.
Like both pre-existing trauma and like preventing trauma happening. Yeah, like if I could wave a magic wand.
Okay,
Yeah.
cool. Well, then what would you do? You'd just be the birth superhero just going everywhere. You wouldn't have to teach anybody
Could be
anything.
like pause. We'd like pause the thing happening and it'd be like, let's consider.
It'd be like an 80s
the
show.
past and the future. And like,
Screen.
what might have happened before this that could be impacting this moment, and like what might happen as an outcome of this moment. Okay, now go.
I'd watch that show. Me and like 6 other people would watch that show.
Story of my life.
Kristen.
It's like, how niche can you possibly get?
So big. It's
We're all
niche.
born. So I feel like
true.
that's pretty big.
Really relatable.
We all are born and we all die. Those are like the only 2 things you can say for sure.
You
Everyone experiences.
help everyone through
birth
a
and death.
process. One process.
Yeah.
That we all share. That's
Right.
a big deal.
Right. So maybe
Yeah.
it's not that niche.
No, it's not. It's just the birth in the birth world. It's niche right now.
Right now.
Soon
I
it'll
like
be
that.
education.
Right now.
Yeah.
I like that.
It's gonna
like possibilities.
Hey nurses, I want to hear what kind of culture is in your workplace to help you with traumatic experiences. What kind of supportive tools are options for you in your profession? We definitely want to hear from you in the comments, so let us know down below right now. This was so fun. So if you want more Birth Boldly tips, you can check us out in the description below. All of her links are down there, and also 125 labor positions for you to download to your phone and take with you to your birth or to work if you are a labor nurse. It's a lot, but it needs to be heard. So share with a friend, throw it all over your social media, and then go find Krysta and tell her how much this video impacted you today. Thanks so much for watching, and I will see you in the next video.